I'm a psychiatrist, and here is something worth reflecting this Monday morning. So imagine you're given an assignment last week for work, and today you're about to turn it into your boss. But before you do that, you're having a chat with your colleague, and you talk about the assignment. He or she sees it and says, wow, this is brilliant work, but what if you changed this? And somehow you find yourself getting tensed up and angry, but you don't know why, you don't know where that is coming from. And the reason you've come to therapy is because it's become increasingly difficult for you to suppress those emotions, that anger and tension that you're experiencing in your interactions at work. And the thing that actually made you come is the last interaction you had with your colleague. He was actually, or she was actually, able to see it in you and apologize for it. So that made you feel much worse about yourself. So we try to look at the interactions to understand what is happening in that interaction that gets you worked up. Because initially you get into those interactions feeling good about yourself, feeling happy, in a good state, but somewhere in that interaction something gets said, or you see something in your colleague, or you hear something that is being said about you, and that is what works you up. So what is that trigger? What is that provoking factor? And as we continue talking, we realize that when your colleague said but, that is what triggered the feelings of tension in you. That is what triggered the anger within you. But what does that but then represent? For you, it represents that you feel inadequate. It represents that you've not done a good enough job, that you're not worthy of any recognition or appreciation for the work that you're doing. And so it's not just the criticism itself that gets you worked up. It's the insinuation of a criticism. It's even the sign that there's a criticism coming that works you up. And as we go on analyzing, we realize that the external triggers are not the actual triggers. The actual trigger is internal. You have been feeling inadequate, but you've been trying to ignore that feeling. You've been trying to numb it. You've been trying to deny it. You've been trying to do anything but engage with it. You've been feeling that you're not good enough. You've been feeling that you're not worthy of whatever position that you're in. You're not worthy of the friends that you have. You've been having those feelings within you, but you've been doing everything possible to avoid feeling, to ignore those feelings. And when we look at feelings, what we know so far is that when you resist the feelings that you have, then they persist, they come at you stronger. And so when you're interacting with your colleagues, everything is okay until this reminder that you're not good enough comes up, this reminder that you're not adequate enough comes up, that you're not sufficient enough, that you're not good enough comes up. These are your reminders of the triggers that you already have internally that you're not dealing with. So you want to really try to listen to your emotions, to what they're saying. I'm not saying every emotion has got an important message that needs to be responded to, but most emotions do carry critical messages that if we listened to, they would have a better time interacting with others, because then we would not be getting reminders from others, would be listening to what is happening to ourselves internally and working on what needs to be worked on, such that when somebody says you're inadequate, you already know you're inadequate, you're working on it. So the way you respond is going to be different because you're aware. But when somebody says you're inadequate and you're not aware, but you're actually feeling it and you're just trying to ignore that feeling, to push it away or to suppress it, then it comes at you stronger, and your reactions are then not measured, they're not regulated, because you can't regulate something that you don't know.